on health and welfare. Madam Secretary, if you could please call the roll.
Senators Coleman,
Here.
Carter, Arthur, Gannon, Moon, Thompson Rader,
Present.
Washington.
We have 6. Having a quorum with 6 members present, I now make a motion to move into executive section. Do I have a second?
Second.
Seconded. We're now bringing before the body Senate Bill 811, which I introduced, which modified various provisions relating to child protection. There was a Senate committee substitute, which was previously distributed. It took out the portion about testing because there isn't currently an FDA-approved test for the genetic genetic illness that was hoping to be able to be tested for, and so we're going to pull that until we have an FDA-approved test. Otherwise, are there any questions? I'm sorry, I need a second to bring 811 before the body. Second. Okay, so moved. So is there any discussion on the committee substitute ending in 04C? Senator Moon, it looks like you've got questions.
So, Madam Chairwoman, that was taking out the metachromatic leukodystrophy test?
Yes,
Great,
sir.
Thank you.
Any other questions? Okay, I move to adopt the committee substitute. Do I have a second? Seconded. All those in favor, please say aye. Aye. Opposed, nay. The ayes appear to have it. The ayes do have it. I now move that we vote on the Senate committee substitute for Senate Bill 811 do pass. Do I have a second?
Second.
So moved. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon, Thompson Rader,
Aye.
Washington. 6-0.
By your vote of 6-0, Senate committee substitute for Senate Bill 811 is due pass. I now move that we make a motion that we leave executive session. Do I have a second?
Second.
All those in favor? Aye. Opposed? We're now out of executive session, and we will now move into hearings on bills, starting with, there's been a change to the schedule. We are not going to be here Senate Bill 813. There were some witnesses who wanted to testify on that bill who were not able to be here, so we're going to not be hearing Senate Bill 813. That was amended, but depending on when you print it off your schedule, it may still be on the committee. So I'd now make a motion that we move, or that we hear Senate Bill 810. Senator Schroer, please come forward and present your bill.
Got like a double microphone going on up here. I like it. Madam Chair, I know I spoke to your staff. We're going to have 2 individuals from my district that are going to be in gubernatorial appointments at 10:30. So I will step out, but I will come back in after presenting those to the committee. For the record, Nick Schroer, State Senator for District 2, presenting Senate Bill 810. This is what I present before you, even though we do have a sub. What I present before you is the identical language that we passed out of the House, presented this last year. And I think at any point in time, looking at the use of our taxpayer dollars and where they're going, I think we need to focus on how they're being allocated right now. And the videos that I think you'll hear about today, stemming from Kansas City, are very disturbing. One of the key items that we put into the heartbeat bill, which I think all of the Republicans, at least on this committee, had a hand in, had a say in, we were trying to stop, and I believe it might have been the lady from Scott's Language, human trafficking. And seeing a Planned Parenthood in Kansas City on the western side of the state diverting minors without parental consent, without parental notification, is massively disturbing. We've seen the issues at the border. We know that human trafficking is still occurring. We know that slavery is still happening. It's happening in my district. And to me, this goes without saying. If you haven't seen the videos, we have them. I believe someone from Project Veritas will be here to testify to the authenticity of these videos. But the fact that our tax dollars are going to an institution that is allowing minors to abort children, whether they're conceived in rape, incest, across the border, without parental notification, I don't have any words for today. I have words for, but I cannot say in this committee. Essentially, what this would do is focusing on these videos from Kansas City and similar videos from the past that we've seen babies, human beings at the beginning of life, being aborted, cut into pieces, and sold, dissected. Again, I have no words for this, but I can tell you this: our tax dollars should not be going to those types of institutions. As illustrated in 810, Senate Bill 810, Planned Parenthood has a very disturbing history. A disturbing history so much so that a branch in New York has actually petitioned to change the name, to disassociate itself with Margaret Sanger. So essentially what this bill does is, because of the previous videos, because of its racist past, its disturbing past, and the current issues with the Planned Parenthoods that are accepting our tax dollars or getting our tax dollars, even though we've defunded them through the budget for over 10 years, and I think everyone on this committee has actually voted in favor of defunding them, Republican or Democrat, correct me if I'm wrong, in the budget for the past 10 years. We've seen the courts, the Supreme Court has said we cannot do that by way of budgetary items. So this is taking that aside, stepping aside, and doing the same exact thing, which is protecting our tax dollars from going toward these institutions. And Madam Chair, I will take any questions right now about this bill, same language that we've had for the past several years, trying to do this outside of the budget. But once I go to committee, I will be back to answer any other questions for any other members that didn't have a chance.
Sure thing. Senator, are you getting a text that you're needing to present right now, or do you have a couple
My
minutes?
phone's buzzing, and I haven't checked it.
Do you want to take a minute and check, and then that way we're not starting questioning? And oh, okay.
Yeah, we're fine.
Okay, Senator Arthur, you had questions. I just didn't want you to be interrupted by him needing to leave. Please proceed.
So I'll clarify. I voted in favor of 10 and 11, which contain vital services for Missourians. I oppose that language inserted in the budget, and I am on record saying such, but I did vote for those budget bills. Although you may have voted against them last year.
I did.
Yep.
And I knew what the courts were going to do. Not to interrupt your inquiry, but I knew what the courts were going to do, looking at, I think it was 2020, when they came out and said that doing this would equate to the same thing of them throwing it out. So,
Well, I wish I had your crystal ball, because it's hard to know what the courts are going to do. And I think we have to keep in mind that you don't know how the courts are going to react as we're passing controversial legislation. Do you know how much did the state of Missouri reimburse Planned Parenthood for services rendered for Medicaid patients?
this past year, I don't have that in front of me. I have that in my folder from last year, which I don't have with me.
Okay, so you don't know if it's $200,000, if it's $1 million that we're talking about, $10 million?
Well, even if it's a penny, even if it's a penny, I think the egregious issues that have been going on from 2015, 2016, when Arkansas and Texas dealt with these issues in the Fifth and the Eighth Circuits.
So I can appreciate that you don't want taxpayer dollars going to fund institutions that provide abortions.
Right.
It's just worth stating, in Missouri, abortion is illegal. So that money is not going to support funding abortions in Missouri. So I think it's worth saying, what does that money go to reimburse in Missouri? Do you know what kinds of services are provided to patients at Planned Parenthood?
Well, I know
affiliates?
the claim over the past couple of years was, there's breast exams that are offered to women. There were calls, and I don't know if it was Project Veritas or a similar organization that contacted the Planned Parenthoods across Missouri, and there was only a small fraction that actually did that. But what I will say is, I think it was my last year in the House, someone from Planned Parenthood was testifying, and Madam Chair, it might have been your committee, where there was an inquiry going back and forth, and it was unveiled that there was a connection to the Planned Parenthoods in Illinois. And even though the money was coming to the organizations in St. Louis or in Missouri, there was that nexus with the others in Illinois or Kansas that are still offering these abortions. And we have seen...
So what services in Missouri does Planned Parenthood get reimbursed for? right? Because we do have
Right.
parameters around what can be reimbursed for Medicaid patients. What services are included within that number? My guess, like you said, cancer screenings, STI testing, probably access to birth control and family planning, which is ironic because, you know, if the goal is to prevent unwanted pregnancies, the reality is if we are denying people access to the health care provider of their choice, in which case many times it's Planned Parenthood, then you are creating a scenario where there may be more unwanted pregnancies, and that can cause additional expense for the state of Missouri if those patients go on to have pregnancies, if they're on Medicaid, if their children then go on Medicaid. So I get that you're saying it's a moral argument, but I'm also saying I've heard you decry government spending, and this is a measure, in my opinion, that will both create more additional unwanted pregnancies if people can't get their birth control, and then if there are children born or mothers who need access to Medicaid, then that increases funding for the state as well.
Well, I think you'll hear today. I know we have witnesses and experts that are going to come forward with testimony regarding the FQHCs that are there to offer these same exact services without the connection to the racist history.
Do you agree that there is a lack of access to health care, particularly in rural areas?
Oh, absolutely, and that's why I'm pushing some of my healthcare reform
So
bills.
why do you want to limit access further? Because a lot of times Planned Parenthood clinics do serve rural populations that don't have other access to healthcare providers.
Well, it's strange that I've seen many of these Planned Parenthoods are in the urban areas. I really am not
Not
familiar.
exclusively.
Well,
And
the majority
in
of
some
them.
cases they are. But why do you want to deny patients the right to go to the healthcare provider of their choice? And again, maybe you know better than I do what the courts are going to say, but we know that under federal Medicaid law, that patients have a right to go to the provider of their choice.
Yeah, and I think a qualified provider. And when they're positioning themselves to say, we cover all of these different issues, whether it's breast exams, cancer screenings, and then we have whistleblowers that are calling in trying to set these appointments up to be told, no, we don't offer those. We don't offer those here. I think similar to the crime statistics in St. Louis right now, I don't know what to believe. And when you look at the FQHCs, there are enough qualified providers to pick up that slack if Planned Parenthood is not getting our tax dollars. And
Well, how can they pick up
real quick, similarly, with all of the money that's coming in to put abortion back on the ballot, I think there's a lot of money there that
Well, how can
Why do
how
they
can
need our
they
tax
pick up
dollars?
slack if there's already a lack of access, right? The problem is there's just not enough care for all of the people who need it. And
Well, I think
so
that
if
goes
we're
beyond-
going to limit further healthcare providers, that's going to make an access issue worse.
Well, we've heard this argument previously, and again, we're going to have experts today to show and illustrate that the FQHCs that are out there to deal with the poorest of our communities, the single moms, the trying to get by, trying to access health care. There are enough FQHCs in our rural communities to address those concerns. I will say, and I do agree with you, and I think you've supported some of my healthcare reforms in the past. Look forward to working with you on that, whether it comes to regulatory reform. We know we have a doctor shortage, but dealing with this scenario, again, even if there's one instance of Planned Parenthood offering something that's good, it's overshadowed by all of the horrific instances that have been displayed, whether it's their upbringing, 2015, 2016, and then now with the most recent videos here in our state.
Well, I think we might have the opportunity to hear from patients who have benefited from those services. So, thank you.
Thank you.
Senator Moon?
Senator, you mentioned in your presentation about what's happening on the western side of the state. To your knowledge, is that also being done on the east side?
I believe it is. I think 2 years ago, I think is when I had my hearing in the House, and it was unveiled that even though Missouri, with the heartbeat bill, House Bill 126 in 2019, and the trigger law once Dobbs overturned Roe v. Wade, the individuals that wanted abortions in our state were being filtered and sent to affiliates in Illinois. We've seen from the most recent videos, they're being sent to Kansas. And again, I disagree with what's occurring, but when you bring minors into it, like what we heard testimony, I believe it was former Representative Rocky Miller was discussing maybe one of his provisions that was in the bill, and trying to prevent incest, trying to prevent human trafficking, and at least notifying, not consent, but at least notifying both of the parents of what is happening with their child. We've seen that breach of the law occurring with the Kansas Planned Parenthood. And I know you've seen all of those videos as well. I know you and I sit next to each other on the floor, and I think when those videos surfaced just a couple weeks ago, you and I were both appalled at what was happening.
Any further questions for this bill sponsor? Thank you, Senator
Thank you.
Schroer. So I'm going to just really quickly try to get a gauge of the volume of testimony we're going to hear today so that we're able to make sure everyone's voice is heard. If you're here for informational purposes only, will you please raise your hand? Is there a representative from the Department of Social Services here? Would you be open to testifying? You might have some of these. Thank you. What about those in opposition? Please raise your hand. Okay, I'm just going to count for a minute. Okay, and how about in favor? 1, 2, 3, 4. Okay, so that's about 15 people. We have about an hour and a half left. So what I would ask is if you're able to please limit your testimony yourselves so that I don't have to limit your testimony. I don't want people who've traveled from across the state not to be able to be heard. I do think that this is a technical issue of dealing with federal law about who can and cannot be disqualified under the Medicaid program, and so I would ask that we have informational testimony to begin with, and then we'll move to in favor and then and then into opposition. So why don't we start with Department of Social Services? If you guys could come forward, please. Thank you, and I appreciate your willingness to testify. I think that sometimes a lot of the questions that the Senator Arthur was asking or Senator Moon was asking can be best answered by the department that administers the program.
Yes, ma'am, Senator. Good morning, everyone. I'm Ryan Conway, the Legislative Director for the Department of Social Services, and happy to answer any questions that the committee may have.
Okay, so I have some to start, if that's okay, Senator. Do you know how many times the department has disallowed a provider?
I do not know that off the top of my head. We will be happy, though, to research that and provide it to your office and the committee.
Okay, can you go ahead and include that on everybody in the committee, please?
Yes, ma'am, absolutely.
And then while you have been working with the Department of Social Services or before your time, are you aware of any time that there has been a provider that has been disallowed?
So we have a unit that's dedicated to fraud investigations, so there would be some that would come out of that if, say, we find fraudulent billing or something like that. You would obviously be disallowed from the program. I apologize, Senator, I do not know the exact numbers, but that would happen from time to time.
So my understanding is that there's 4 reasons that there's mandatory disallowance under 42 USC section 1320A-7, and those are fraud type things that you're discussing. So conviction of a program related crime, conviction related to patient abuse, felony conviction relating to healthcare fraud, or felony conviction related to controlled substances. Do you think that those disallowances are following under mostly those mandatory 4?
I think that would be fair to say, Madam Chair. Yes.
Okay, and then there's just an entire litany. I'm not going to read it to everybody, but I'll make sure that the committee gets it about permissive reasons for exclusion of a Medicaid provider, and those range from misclassifying types of drugs to misrepresentation of material facts, all the way to exclusion or suspension under a federal or state health care program as defined relating to professional competence, performance, or fiscal integrity. There was a significant fight in Missouri about revoking a license of a Planned Parenthood provider, and a lot of litigation around that particular piece of information. Is that right?
Yes, that's correct, ma'am.
And do you know what the conclusion of that litigation was?
I believe that was before my time, but we'll be happy to provide that back with a more complete legal landscape of how that turned out.
Okay, great. And then do you know how much was provided to Planned Parenthood in reimbursements under the past 3 budgets?
The past 3 budgets, so it's been this currently 0 and 0 going back to, I believe it was 2021 when the Supreme Court issued an opinion that the language within 11 prohibiting reimbursement to Planned Parenthood was unconstitutional.
So there was an attempt to do this through the budgetary process once. That was disallowed by the Supreme Court. There was a second attempt, and my understanding is that litigation's ongoing. We're awaiting a ruling.
Yes, Madam Chair, that is correct.
Okay, and that, in the meantime, while that litigation is pending, do you know if the state has provided any reimbursements to Planned Parenthood?
At this point, no, the department has not, but obviously
I
pending.
guess that could be a state treasurer question.
Yeah, I can only speak on behalf of Social Services and MO HealthNet Division. I don't believe, but I want to make very clear that I can't speak as a matter of fact to other departments, but I don't believe they have. No, ma'am.
Okay, and then do you know how many federally qualified health clinics are in the state of Missouri and how many Planned Parenthood clinics there are in the state?
Oh, that I do not know either, but again, we'll be happy to.
Okay, sometimes Missouri Foundation for Health comes to these hearings. Maybe they have that information, but if you're able to get that to the committee, that would be helpful as well.
Absolutely.
Thanks for being willing to be on the hot seat, Senator Arthur.
Happy to.
Senator Washington.
Thank you. Thanks for being here, Mr. Conway.
Absolutely.
Real quick, you mentioned that you couldn't speak on other departments. What other departments could conceivably reimburse Planned Parenthood for Medicaid services provided to be paid by Medicaid?
At least in theory, I believe those covered under House Bill 10, so mental health and health and senior services could, but I do not want to say that they have or that it's even actually happening. I just want to make sure that I'm not saying it doesn't happen anywhere in the state and in fact be wrong later on. I can only say that it's not happening within social services.
Okay, which is where the majority of Medicaid reimbursement occurs, correct?
Yes, Senator, that's correct.
Okay, thank you.
Yes, ma'am.
Any other questions for this witness? Seeing none. Thank you so much for your willingness to testify.
you.
Anyone else here for informational purposes only? Please come forward. If you haven't testified in a hearing in the state of Missouri before, make sure that you fill out your witness form and make sure you state your name clearly so we're able to have it for the record. Go ahead and proceed when ready if you'll introduce yourself.
Good morning. My name is Jordan Weldon. I'm here with Project Veritas. If you're unfamiliar, Project Veritas is a collection of journalists reviving the great American tradition of investigative journalism. We use undercover video to expose corruption and to reveal hidden truths. This organization was founded by James O'Keefe and is well known for breaking some of the biggest stories in a generation. We tell the stories that corporate media is afraid to cover. Our content is impactful. Sometimes it's uncomfortable to watch because it reveals that the truth is more than what meets the eye. I am honored to represent a movement of truth tellers here today, people who are motivated to tell these untold stories. I'm here today to talk about an investigation that we released in December. This was footage of employees at the Planned Parenthood clinic in Independence, Missouri, describing their process for facilitating and helping to conceal secret abortions for minors. In this investigation, the journalist entered the Planned Parenthood clinic. He was posed as the older uncle of a minor girl, 13 years old. He was asking for assistance to terminate her pregnancy secretly and quickly. He made it clear to the Planned Parenthood clinic employees that the parents could not find out about this. The clinic manager appeared unfazed by this scenario, and she told him, quote, "We never tell the parents anything. This is not our first rodeo." The clinic director's name was Lashana. She told the journalist that Planned Parenthood would offer the following services to the minor. They would get the child out of school. They would use a disguised doctor's note. They would be willing to cut off their logo from the doctor's note to conceal where the child had been. They would transport the minor across state lines from Missouri to Kansas. They would put her up in a hotel and they would pay for it all. and they would not tell the parents a thing. When asked how frequently Planned Parenthood engages in moving minors across state lines for secret abortions, the clinic manager laughed and said, "Every day." The video we released also revealed the shocking ease with which an adult can facilitate a young person's abortion despite being unrelated to her. At no time did the Planned Parenthood officials ask for any ID. They didn't ask for any proof of relation or any other evidence that would indicate that this journalist was indeed the uncle of this child. The clinic's casual admission of its willingness to transport minors across state lines and also to conceal it from parents raised concerns as far as the way that Planned Parenthood services could potentially facilitate and help conceal the sexual exploitation of children. We released this investigation the week before Christmas. It's now garnered about 5 million views. I'm here as an informational witness simply to ask or answer any of your questions that you might have about our video, and hopefully also to represent in a small way those people out there who are seeking the truth, particularly those who are wanting to know what goes on behind the scenes of powerful institutions like Planned Parenthood, which are funded by taxpayers. It's an honor to be here today. I'm happy to answer any questions that you may have. I hope I can be helpful to you.
Thank you very much. Senator Washington.
Hi, good morning. Thank you for
morning.
being here. Couple of questions. Which Planned Parenthoods in Missouri are funded by taxpayers?
I'm not sure.
Did you hear Mr. Conway's testimony?
Yes.
Did you hear Mr. Conway say that there were 0 claims paid to Planned Parenthood in the last 3 years?
Senator, I believe he was going to get us the data on that he said he wasn't that he was unsure.
He said he was unsure for other departments, but that his department pays the majority of the Medicaid claims. He mentioned mental health, which is not offered by Planned Parenthood. Is that correct? Do you know, ma'am?
I don't know.
Okay. So my other question is, what journalism school did you go to?
I didn't go to journalism school.
What journalism school did the young man that went into the Independence Planned Parenthood go to?
He didn't go to journalism school.
So let's not, journalist is not a loose term that is on anybody who has a video or a camera. So-
Journalism is simply individuals who are
you don't want to
courageous.
go there with me. I'm really being nice. But the last thing you want to debate with me is what makes a journalist, since I have a journalism degree from the #1 journalism school in the world. And I have a brother who died 2 years ago who was one of the top news producers in the world by working at CNN, Al Jazeera America, and Al Jazeera, so that we don't want to debate that one. My godparents own a newspaper, and all of us have journalism education. So I just wanted to get that out. But my other question is, there was some concern about not contacting the parents, correct?
Yes.
What are the HIPAA rules with respect to a medical provider contacting the parents?
All I can say is that the clinic director, LaShawna, told the individual that they would not be contacting the parents. They would provide all of these services without informing the parents, and that this is something that they do every day.
But what are the rules? What are HIPAA's rules with respect to releasing information about a patient?
We felt this information was of vital public interest.
Do you not know? Because it's okay to say I'm not aware.
I'm not aware of the HIPAA
Okay,
rules
then
in this state.
let's leave it there. And do the pregnancy centers always notify the parents?
Ma'am, I'm not here to talk about any other pregnancy centers. I'm simply here to talk about what we revealed.
Okay, thank you.
Any other questions for this witness? So I have a quick follow-up question.
Sure.
One of the things that I think is difficult when we're having informational testimony is that it's hard to verify the information that's provided. And so I appreciate you naming the location. Do you know what date that was?
Yes, this was filmed on November 10th.
November 10th. And that was at a clinic at what was the address?
The address is 815 Nolan Road in Independence, Missouri.
And you can verify that that was done by somebody who was either employed or the kind of chain of command of that video was taken place. Can you talk a little bit about how you're able to verify the authenticity of that?
Of the location?
Of the video itself.
Oh, yes. A source brought us this video, and we were able to confirm it based on, knowing him and knowing the address, and also the employees being, dressed in Planned Parenthood scrubs. They had their badges on that indicated they were employees of the clinic.
Okay, great. And was this edited down in any way to try to change the context of what they were saying? Sometimes people will say that these videos, kind of citizen journalism is not necessarily the complete picture, or it's kind of cherry picking quotes.
No, we don't deceptively edit our videos. The raw is about 4.5 minutes, and we use almost the full time in our video. You'll be able to see the individual is able to complete their thoughts. It's a full conversation that's recorded. It is not cut. It's clear communicating what she is able to offer.
Okay, I appreciate it. Thank you for your
You're welcome.
testimony. Yes, Senator Arthur.
Do you live in the state of Missouri?
I don't.
Where do you live?
I live in New York.
Okay, so you're visiting from out of state.
Right.
Can you remind me, how much was Project Veritas ordered to pay in the lawsuit where it was found that they illegally wiretapped and used deceptive practices?
I'm not sure. I was not at the organization at that time. I'm just here to talk about the investigation that we produced in December.
Can you appreciate why there's some skepticism around that video, given the organization's history?
I think the organization's history is that of releasing bombshell videos that break the public narrative on things that powerful people want to keep secret.
So how did you become aware of the hearing? Were you invited to testify?
Yeah, we were invited by the senator. She let us know that there would be a hearing and they would be talking about our video, and we offered to come and speak about what we revealed there.
Okay. Who's covering the cost of travel and your visit to Missouri?
Up until this point, Project Veritas has paid.
Got it. Okay, appreciate it. Thank you.
You're welcome.
Any other questions for this witness? Seeing none, thank you for your testimony today.
You're welcome.
Is there anyone else here to testify for informational purposes? Seeing none, is there anyone here to testify in support of, what number is this, Senate Bill 810? I'm sorry, it's early in the year and I'm memorizing the numbers still. Go ahead when you're ready.
Good morning, Senator. For the record, Susan Klein, representing Missouri Right to Life, here to go on record in support of Senate Bill 810. Pro-life Missourians have worked really hard to get us where we are in Missouri today. We have had great legislators that have voted for great bills, and we appreciate everything that the pro-life legislators have done. But one of the things that we have fought for many, many years is public dollars going to Planned Parenthood. Even before the Dobbs decision overturned Roe and Missouri's trigger law was able to go into place, obviously the trigger law enacted laws in our state that have a life of the mother exception and an emergency exception. And they have done well. They've served women and unborn babies across this state well. But funding of Planned Parenthood, we're talking about an organization prior to the overturning of Roe, an organization that was caught by our own Department of Health in Missouri to have multiple infractions over the many years. We're talking about rusty equipment, expired drugs. So Planned Parenthood has a history of not necessarily providing the best care for women across this state. When you talk about federally qualified health centers, if you go to their website, on their website, it shows all of the facilities that they have. The majority of them are in rural America or rural Missouri. And you can look at their map. There's 233 of them. They provide great services. So there are places that women can get care. But continuing to use public funds to an organization that has had a history of infractions from our own Department of Missouri is something that Missouri Right to Life and pro-life Missourians and the majority of Missourians does not support. So we're asking for pro-life protective language to go in statute to prevent our public dollars from going to an organization that is affiliated with the largest abortion provider in the United States. I think that is common sense for Missouri based on the history of the infractions of Planned Parenthood in Missouri.
Thank you for your testimony. Is there any questions for this witness? Senator Washington, please proceed. And
Hi.
Hi, Senator.
Go ahead. It's fine.
Do you know if there are qualifications that before I can have treatment at an FQHC?
I don't know that, Senator.
Okay. If we don't know that, we probably shouldn't make it seem like a woman can just jump and go to an FQHC. I have several in my district, and it is just not that easy. Everyone can't have that service, so I just want to put that on the record, that there is a qualification process. Having Medicaid alone is not does not give you the right to do that. The next question I have is, do we still have our pregnancy crisis centers?
We do have pregnancy help centers in the state of Missouri.
And how much do we fund? How much money do we fund to them?
The state of Missouri has done a wonderful service to women by providing alternatives to abortion, Show Me Healthy Babies insurance, care for women for a year after the termination of a pregnancy.
I'm just talking about the money to the pregnancy centers, ma'am. Just, if you don't know the answer, it's okay to say you don't know.
I'm just telling you what the state funds.
I didn't ask you that. I asked you how much they funded the pregnancy centers.
You would have to ask the pregnancy centers that.
Okay. And those women that go there, if they, you mentioned alternatives, what is the percentage of those children that are left orphans?
You would have to ask them that question.
Okay. What does Missouri Right to Life do to facilitate a good home for a child, an unwanted born child?
Missouri Right to Life supports the Alternatives to Abortion program, the Show Me Healthy Babies, and the insurance.
You give them
for
money?
women.
Do you give them money?
We help women find what they need
Okay, how?
by referring them to agencies that will give them help.
Has that helped our black and brown babies, who are the largest number of children left in foster care up until adulthood?
We help all women.
How many black and brown babies are you helping get adopted?
Missouri Right to Life supports adoption.
Do you give some money to those who want to adopt them, or some money to the child or whoever is taking care of the child that has been forced to be born?
We help women find the resources that they need.
Okay. I had another question. What was that question? How do you help prevent maternal mortality?
I think the best thing for women is to get good quality health care, and they need to be able to trust the source that they go to, and obviously Planned Parenthood has not shown that history in the state of Missouri.
Have we gotten complaints? I mean, this is my 4th year here, my 7th year being with you. I've yet to have someone testify that they did not appreciate the services they received at Planned Parenthood. Do you have a witness here today that will talk about that?
I'm sure you can look in the Department of Health's history and the reports that came in on the infractions of Planned Parenthood.
Do you have any people that will tell you that they were not satisfied? I had a dentist that apparently didn't know how to properly give me pain medication, but I'll be honest, and he got in trouble with I think CMS, with Medicare for older people. But I'll be honest, I was perfectly satisfied with the service that I received, because that didn't happen to me. So that's what I'm asking you. Do you have some folks who actually are serviced at Planned Parenthood who are complaining about the quality of care they received?
I don't know if they're here today, Senator, or not. I know there is a large group of women in an organization called Silent No More that are speaking out about the care and about their abortion.
Okay. What specifically is Missouri Right to Life doing to help us bring down our maternal mortality numbers? Because that's a right to life also, right?
We are working to help people find the resources that they need.
Give me a
Uh,
resource.
Alternatives to abortion, Show Me Healthy Babies.
What does that have to do with making sure a woman lives through the first year after her child is born?
Those insurance programs, especially the postpartum care and the Show Me Healthy Babies, helps women while they're pregnant.
And what does
Alternatives to Abortion
What
does
is
too.
your specific support for those organizations or those departments?
We lobby, obviously, for the state to continue funding
You actually
those
lobbied
programs.
against it,
Not against Alternatives to Abortion. and
but you
Show Me
did
Healthy
lobby
Babies.
against the extension. So that's it. I'll let someone else ask you some questions.
I just have a follow-up question to Senator Washington's question. Last year, you testified in support of Senator Gannon's Senate Bill 45 and 90 extending postpartum coverage for pregnant women. Isn't that correct?
We did. We did want the end of pregnancy defined, but we did.
And just, you did that, your testimony, if I remember correctly, to this committee was because you were concerned about helping drop the mortality rate for women postpartum. Is that correct?
That's correct.
Thank you. I appreciate that. Any other questions for this witness? Okay, thank you.
Thank you, Senator.
Anyone else here to testify in support, please come forward. We have about 14 more people who are wanting to testify, and we only have about an hour and 5 minutes for that testimony to come in. I think it's important that when citizens drive in, they have a chance to be able to testify to the committee. So I just ask that we try to keep our questions, and it's relevant, it's important. We need to be able to ask witnesses questions, but I also want to make sure that everybody's able to testify. Go ahead.
My name is Jeremy Jacobs. I'm with Bound for Life St. Louis, and I'm here to add my yes to this bill, even though I'm not voting. My support behind this bill. I think it's interesting that members of this committee have questioned or impugned the history of other organizations, and certainly in Senator Schroer's testimony to begin with, he was doing the same with the history of Planned Parenthood. This is, in my estimation, a wicked organization that supports a barbaric practice. The state of Missouri has agreed with that in law with HB 126, and it's high time for the state to remove funds from organizations that support this barbaric practice. Thank you.
Thank you, Mr. Jacobs. Any questions for this witness? Yes, Senator Arthur, please proceed.
So it's been discussed, but I will give you the opportunity to weigh in. Do you oppose the state of Missouri going to reimburse Medicaid patients services, including things like birth control? Do you think that's okay to?
I think what's in question here is organizations that support a barbaric practice.
If you could just answer the question, we're limited on time. Do you support the state of Missouri reimbursing services like birth control
To organizations that do not have,
to healthcare providers?
to healthcare providers that are not practicing other barbaric practices, I really don't have a problem with that.
Is abortion illegal in Missouri? Are Planned Parenthood affiliates providing abortions in Missouri?
There are many things that are illegal in Missouri.
So no.
But
the
if-
answer is no. Do you oppose Medicaid reimbursing healthcare providers for services like STI testing?
I think the root of the question here is
No, that's
the
not the question I asked.
organizations
The
that
question I
support
asked is, do
barbaric
you-
practices, and we don't want our taxpayer dollars going to organizations that support
You and I
barbaric
can disagree
practices.
about abortion, but it is not happening in the state of
The
Missouri.
state of Missouri recognizes it as barbaric.
Abortions are not happening in the state of Missouri. It is banned. So do you oppose? Well, thank you. Thanks.
Any further questions for this witness? Thank you for your testimony. Is there anyone else here in favor? Please come forward. And I think I've been paying attention, but as you come forward, make sure you fill out your witness form, please. Go ahead and proceed when ready.
Thank you, Madam Chair and members of the committee. Samuel Lee with Campaign Life Missouri. Want to go on record in support of Senate Bill 810. I've gotten written committee testimony. I'll email it to all the committee members. And We support this legislation. We think that, as many people have said in the past, budgets are moral documents, and it's immoral to spend money on organizations that provide and promote abortions. And as written here, Planned Parenthood has been the largest provider and promoter of abortions, not only in the United States, but throughout Missouri over the years. They have attacked pro-life laws that you and your predecessors have passed for the last 50 years, and they don't deserve to get any of our state tax dollars. I'll keep it simple, but I'm happy to answer any questions. Senator Washington, if you want me to answer a couple of your questions, I think I have information. Would you like me to do that? Okay. On the Alternatives to Abortion program, the legislature appropriated $8.66 million. Been for the last couple of years. That does not only go to pregnancy resource centers. It goes to maternity homes. It goes to Nurses for Newborns participates in that. But a significant number would go to pregnancy resource centers. On the tax credits, the Pregnancy Resource Center tax credit, for the last full year, for information that's available, which is fiscal 2022, about $5.8 million in tax credits were redeemed by donors to pregnancy resource centers. Happy to answer any other questions, Madam Chair.
Senator Washington, did you have a follow-up? Senator Rader, Thompson Rader, excuse me.
Mr. Lee, I just want to say that I very much appreciate the fact that you guys not only work on our pro-life, our abortion issues, but you absolutely have shown support for the children once they are born. And you and your wife, the work that she does as well. I just want to say thank you for that.
Well, thank you, Senator. It's been an honor to work with actually literally every member on this committee on various legislation that helps moms and babies and families, child care and all sorts of things. And it's an honor and privilege to do that. And I just thank you for letting me participate in that.
Any further questions for this witness? Seeing none, thank you for your testimony. Oh, go ahead. Sorry. Yeah. I'm sorry. I miscounted in my head. So if I seem surprised, I thought we were nearing the end of in support. Please proceed.
I won't take it personally, I suppose, but Jamie Morris, representing the Missouri Catholic Conference, here in support. And I will be brief. I'd like to echo what the previous witness had said. And again, from the church's perspective, we do understand the concerns, with maternal mortality, with the full gamut of pro-life. And I think we've tried to do a good job here, whether it's supporting Medicaid expansion, which we did receive some heat for, the expansion of eligibility for mothers postpartum, the Show Me Healthy Babies. All of this is, are good policy. Even, childcare concerns, this session has been a big one. But, as one of our foundational principles is that giving taxpayer money to an organization such as Planned Parenthood just isn't the right answer. And even if you were to concede all of the good, medicine that comes out of this, I think we've been asked, over and over again to kind of accept the good with the bad. And, what's also being missed here is that, at any time, an organization, if they do not perform abortions or have affiliates that perform abortions, can be eligible for Medicaid reimbursement under this. And, again, I think the burden has kind of always been on our side to just accept the good with the bad. And I think we have much better ways of addressing this issue than taxpayer dollars going to organizations that provide abortions. But I would be happy to answer any questions.
Thank you. Is there any questions for this witness? Seeing none, thank you for your testimony. Is there anyone else here in testimony in support of Senate Bill 810? Okay, seeing none, is there, I think that I saw the lobbyist for Planned Parenthood who's here, so maybe if you'd like to come forward first so that we can get Planned Parenthood on the record and have as much time for questions as we need, and then we'll move to those who've come.
Madam Chair, members of the committee, my name is Ron Berry. I'm a registered lobbyist here on behalf of Great Plains. Planned Parenthood Great Plains votes, and we just want to go on the record in opposition of this. We believe that there's going to be a gap in coverage because this is a Medicare issue, or excuse me, a Medicaid issue. Yeah, well, I haven't had the opportunity to be elected, so I make lots of mistakes. We do believe that there's going to be a gap in coverage for those individuals if this legislation was to go forward. We don't. I think the real issue here is that we forget that abortion is illegal in the state of Missouri. So none of the affiliates, none of the clinics in the state of Missouri provide abortions. What we do provide is services for health care, such as cancer screenings, such as family planning. These are services that are vital to our healthcare system and vital to our communities. And if you take away the funding for this, where are these individuals going to go?
So I'm glad you talked about funding right at the end of your testimony. The chair has some questions. Do you have the dollar amounts that you've received as your affiliate or the organization that you're testifying in support of over the past 3 fiscal years?
So only just in the last fiscal year, I believe the current fiscal year, it's been less or something around $200,000 that have gone to the affiliates across the state.
Across the state, $200,000?
Correct.
Okay.
But you know what, Senator? I need to verify that because I don't know that I can
No,
like
if you
give
could
you
get that
the,
to the committee, I would really
Yes,
appreciate
ma'am.
it. Okay, so you were here for the testimony earlier, and I just have some questions about ownership structure. I think we get questions about what is an affiliate, what does it mean to be related to. Are the Planned Parenthood clinics that are in the state of Missouri owned by any entity that provides abortion services?
Abortion is illegal in the state of Missouri.
That wasn't my question. My question is, are any of the Planned Parenthood clinics in the state of Missouri owned by an entity or a parent corporation that provides abortion services?
So I don't know if I fully understand your question because we don't allow abortion in Missouri. We do have clinics in the state.
The ownership of the clinics, are they owned by any affiliate or parent corporation that does provide abortions outside of the state of Missouri?
I don't know how the facilities are owned as far as the buildings go.
I don't mean the buildings. You can rent from anybody you want. I mean the corporate structure of the clinics.
All right, let me see if I understand the question that you're asking. So in Missouri, we have, I think it's 8 clinics, and I probably am wrong.
And where are those 8 clinics? We hear a lot about them providing rural access, but my understanding is that none of those 8 clinics were located in rural locations. Is that
maybe
correct?
it depends on what your definition of rural is. 'Cause
Where
we're
are
in
they?
Springfield.
Where are the 8 clinics?
Springfield, Kansas City,
I think-
Independence, north of the river in Kansas City, St. Louis.
So not really rural locations under any sort of definition that's widely accepted in the building.
I guess it depends on your definition of rural. Sure.
Okay, so talk about the ownership structure, please, of the clinics in the state of Missouri.
So I represent Great Plains out of Kansas. Kansas is this, Great Plains represents Kansas, Missouri, Arkansas, and Oklahoma.
And do any of those states allow abortion services?
Kansas does.
Correct. And so you own the clinics then? That entity owns the clinics in the state of Missouri?
Madam Chair, I'm not prepared to answer that question because I don't even know if I fully understand what you're asking me.
Okay, well, listen, I'm happy to follow up on,
Sure, I'm happy to have-
because there was a lot of questions about what does it mean to be affiliate. So these
Sure, I
8
would
so I think
agree.
it's important that we understand what does affiliate mean, because if what's keeping these clinics from being defunded in the state of Missouri is their affiliation with Planned Parenthood, couldn't they just drop that affiliation and continue to provide care?
So basically you're saying because someone is associated with another state.
Well, you can't tell me what is affiliation or association, so I'm
That's
asking
because it's
about
not
the
clear in the
corporate-
definition in the statute that you proposed.
I'm sorry, it's not my bill, and
Well, excuse me,
you should know your own corporate entity structure. That's a pretty basic question.
I am a registered lobbyist. I am not a staff member of Planned Parenthood.
Okay, so let's pivot to staff members of Planned Parenthood. Have you had any conversations with any of the directors of the clinics after the video was released by Project Veritas?
I have not had any opportunity to watch the videos. I don't know anything about the videos.
Well, you were in the room when the testimony
heard
occurred
the
earlier.
I did.
Okay,
I did.
so can you please ask your client to provide information to this committee about whether the employees who were captured in the video were employed at the time and are currently employed, or whether they have been terminated for violating the policy of the entity? Because at the heart of this issue is if they are owned, which you can't tell me, by an external entity that does provide services, and if their recorded testimony, now it was not necessarily meant to be testimony, that's for sure, but the recorded statements that they made was that they regularly violate the law of the state of Missouri and move children out of the state without parental consent, then I'm just wondering if they're still employed or whether that violates the policies of your client. So we'll follow up with that. It sounds like you don't have that information.
No, I'm here to testify on 810 in opposition to the language that's before us.
Right. At the heart of that language is whether or not those employees are employed by an entity that is providing abortions. And so that information is going to be really vital. Okay, moving on. I think we'll see if there's any further questions. It looks like Senator Washington is ready to go, so I will have her go ahead.
Yeah, I just have a clarifying question. The chair asked about the locations of Planned Parenthoods, and is there still a Planned Parenthood location in Joplin?
I don't know the answer to that. I don't believe that there is. Okay.
Yeah, as well as Rolla.
But I
Missouri.
believe that's part of the Oklahoma affiliate.
I'm not asking who it's part of. My question is, and I love you to death, but I'm gonna have to agree with the chair a little bit. You gotta make sure you know a little bit more information about Planned Parenthood. But just so we are on the record, there are Planned Parenthoods in rural Missouri. There is one in Rolla, and there is one in Joplin.
Earl.
I'm sorry.
No, just confirming that there is one in Joplin.
Yes.
Okay, thanks, Senator Washington. Any further questions for this witness? Thank you for your testimony. Anyone else here in opposition?
Good morning, Chairwoman. My name is Michelle Trupiano. I'm the Executive Director for Missouri Family Health Council. I've been here before you many a times because we are intimately familiar with the landscape of how family planning services are delivered throughout the state of Missouri, the gaps in care that are already experienced by women throughout the state. We run the Title X Federal Family Planning Program. We have for over 40 years. We also run the Right Time Initiative, and through that, we administer funding to a variety of safety net providers throughout the state, including FQHCs, health departments, community action agencies, and Planned Parenthood. What I'm here to tell you is what we know because we talk with providers every day, is that the safety net is broken, that there are not enough providers, period. That we know that for many providers or patients that when they are seeking care, especially if they are a new patient, that it takes them, anywhere from 3 to 6 weeks to be able to get into a provider. That there is, I think you guys already know this, that there's a healthcare shortage throughout the state. And so our network of providers serve approximately 40,000 patients throughout the state with family planning services. Planned Parenthood serves half of those. We have over 17 health entities and 68 clinic sites. And so we're in urban areas, we're in very small rural areas. We work with health departments, we work with FQHCs. They all see a different volume of patients dependent upon the needs in their communities and the volume of patients that need access to care. How Medicaid works, in terms of any of the providers, is that when a patient is on Medicaid, that they get to see for family planning services the provider of their choice. They get to pick which provider best meets their needs for whatever reason. And so if a patient is going into Planned Parenthood, that is their choice in terms of who they are seeking to receive their care from. For any Medicaid patient, they receive their services, whatever services they need, and then the provider bills Medicaid for those services rendered. And so that is how that reimbursement process works. What I'm just here to say is that what we know is that the safety net cannot take additional cuts to care. We need to be doing more to actually strengthen the safety net, that we know that there are tremendous amounts of gaps throughout the state, and that there are many patients already that are struggling to access care, especially to vital family planning services. And if you put another hole in the safety net by eliminating Planned Parenthood, that safety net is going to break, and it's not just going to affect Planned Parenthood and how they keep their doors open to ensure care. It's going to affect every other safety net provider, because when you're talking about 20 to 30,000 people, the safety net cannot absorb that many more patients without it creating tremendous obstacles for patients. So instead of a 3 to 6 week time frame for them to access care, you're going to talk months. And when we're talking about family planning services, people cannot wait months, whether that is to access their birth control, whether that is to access their STI screenings and treatments, whether that's to access cancer screenings. So what I'm here to ask you is what the courts have already ruled again and again, and I feel a little bit of like in deja vu because we keep on coming back to this question, is that Planned Parenthood, we know, is a tremendously high quality provider and provides excellent care to patients, and that we need more providers throughout the state, not less.
Okay, so I have a couple follow-up questions. You were saying that you oversee a significant portion of the budget, and I know that you do that on helping work with allocation to these FQHCs.
I'm sorry, can you repeat that? I missed the first part.
Yeah, so you were talking a little bit about, you know, intimately the details about the budgeting process over these FQHCs and where the allocation of the Medicaid funding is coming from. Is that right?
No, not the budget process of how FQHCs are allocated. What we know is the landscape of family planning services, what the gaps are, and what providers are saying that they need. And we know what patients are experiencing, the obstacles that they are currently facing in terms of accessing care.
Are the Planned Parenthood clinics that you are working with in the state of Missouri and the affiliated 68 different locations that you have seen them doing work in, or they're continuing to do work in, are those Missouri-based providers, and are they providing services exclusively in the state of Missouri?
So if I can, of the 68 clinic sites that we have throughout the state, only I think 8 to 9 of them are Planned Parenthood. So the rest are health departments, FQHCs, community action agencies, and those are all Missouri-based providers.
And the 8 Planned Parenthood providers, of those, they're also Missouri-based providers. They live and work in the community.
Correct.
So my question then is, why could they not simply drop the affiliation of Planned Parenthood and continue the work that they are doing as a clinic and be able to receive services and funding through the state of Missouri? We now have seen that number drop to just $200,000. So if that is a $200,000 amount that's being sent to them, why not have these Missourians continue to provide? Why is that Planned Parenthood logo so important to them that they would rather be a part of that than serve the women in their communities?
I can't speak for Planned Parenthood. I don't work for Planned Parenthood. What I'm here to say is in terms of...
No, I appreciate it. That's fair enough. I'll let you get off the hot seat. Anybody else have any other questions? Thanks so much. Anyone else in opposition?
Good morning. My name is Kimber Palmer. I'm from St. Charles. Came over here this morning. I volunteer to support Planned Parenthood patients, and I know they rely on them for critical care. And I'm here to ask not to take away that important medical care for my loved ones, my neighbors, and the people that I support as volunteers and Missourians.
Thank you for your testimony. Is there anyone here who has a question for this witness? Thank you for being here today.
Thank
and thanks
you.
for driving in.
Yes, do I?
Just, you leave it on this pile right there on the, yeah.
Gotcha.
Perfect. Anybody else here to testify in opposition?
My name is Catherine Ryan. I'm from St. Louis City, and I want to thank you for letting me testify. I support Planned Parenthood and believe in its service to hundreds of thousands of Missouri patients. Please don't take away that form of care from people that I love, my neighbors, my community.
Thank you for being here today. Anyone have any questions for this witness? Seeing none. Thank you.
Good morning. My name is Lisa Williams. I am from St. Louis, and I was a patient at Planned Parenthood for many, many years. Please don't take away my neighbor's health care.
Thank you for your testimony. Anyone else have any questions for this witness? Thank you.
Good morning. My name is Kara Heil, and I'm a Kansas Citian and a Missourian who relies on care provided at Planned Parenthood health centers. Do not take away my care. Thank you.
Thank you for your testimony. Anyone have any questions for this witness? Thank you for being here today.
Thank you.
Good morning. My name is Sam Howakhorst, and I'm from St. Charles. Sorry, let me get my... When I was uninsured back in 2015, I heavily relied on Planned Parenthood for critical and preventative care. I'm asking you to please don't take away the care of hundreds of thousands of Missourians who, like me, have relied on Medicaid for their care and trusted providers at Planned Parenthood.
Thank you for your testimony. Any questions for this witness?
Thank you.
Anybody else?
Is it okay if I sit here?
Good morning. My name is Sarah Feltz, and I'm from St. Louis. I am and have been a Planned Parenthood patient for a long time. Please don't take away the care from me, my community, my neighbors, and people that I love.
Any questions for this witness? Thank you for being here.
Hello, my name is Maggie Olivia. I use she, her pronouns, and I am a Missourian who relied on Planned Parenthood health centers very heavily when I was uninsured. Now I'm lucky enough to have insurance through my employer, and Planned Parenthood is still the only provider that I feel safe and comfortable going to for gynecological health care because of my history of experiencing sexual violence. I've had some really bad experiences with other gynecological healthcare providers, and Planned Parenthood health centers are truly the only place where I feel safe to access that level of intimate care, and I know that that is true for many of the folks who receive care at Planned Parenthood as well. However, today I am not here representing myself. I am here on behalf of Abortion Action Missouri. Formerly Pro-Choice Missouri, so I'll respond to either of those names. We're still getting used to the name change as well. Abortion Action Missouri works to protect and expand every Missourian's right to bodily autonomy, to access essential reproductive health care, to access accurate information so that we can make the best decisions for ourselves and our families, and to parent our children in safety and dignity in our own communities. We know that in the state of Missouri right now, it's dangerous to give birth. It's dangerous to want to be a parent in the state of Missouri. We have some of the highest rates of maternal mortality, and we also know that in 2020, states that had the most restrictions on access to sexual and reproductive health care, including Missouri, saw 62% higher rates of maternal and infant mortality than states without said restrictions like that exist in our state. I will say that hundreds of thousands of people across our state rely on Medicaid for their rely on Planned Parenthood for their critical care. Approximately 650,000 Missouri women rely on Medicaid for essential health care. That's more than half of the state's Medicaid population. Planned Parenthood is an essential provider of that critical care, and as you have heard, the rest of the safety net simply does not have the capacity to take on the number of patients that would be left in the lurch if they weren't able to access that care at Planned Parenthood clinics. So I will say, like those ahead of me, I am a patient who relies heavily on Planned Parenthood. Don't take away my care. Thank you.
Any questions for this witness? Thank you for being here today. Anyone else here to speak in opposition?
Good morning. My name is Amy Quo Hammerman. I'm a volunteer with the National Council of Jewish Women in St. Louis. We are an organization inspired by and driven by Jewish values, and our mission is to improve the welfare of women, children, and families in Missouri. Among the values that are that drive our mission is the idea of pikuach nefesh, which is Hebrew for saving souls and lives. And we believe that supporting healthcare providers that serve our safety net, like Planned Parenthood, is integral to saving souls and lives. We serve a number of women, a lot of women actually, who depend on Medicaid as their health insurance. They are often survivors of domestic violence. They are women who are trying to get on their feet. They are often working more than one job. And Planned Parenthood is vital to access their health care. They have extended office hours. They offer weekend and evening hours. And frankly, I don't know any woman who is really all that excited to run off and get their pap smear, but it's vital. This month is Cervical Cancer Awareness Month. If you take away that provider of vital health care, what are we doing for the women who want to protect their health, particularly their reproductive health? A lot of the women we serve want to preserve their fertility, and one of the ways of doing that is to get regular reproductive health care, and Planned Parenthood serves that. So we urge you to not vote this bill out of committee.
Any questions for this witness? Thank you for being here today. Anyone else here to testify in opposition to Senate Bill 810?
Oh, no, you're fine. Okay. Good morning, committee members. My name is Sage Coram, and I am here on behalf of the American Civil Liberties Union of Missouri and our approximately 15,000 members statewide. And I'm here to express our strong opposition to SB 810. The ACLU of Missouri is committed to ensuring all Missourians can access the health care they need, free from discrimination and with equal access. By targeting facilities that provide abortion care, as well as their affiliates and associates, SB 810 is a direct attack on the principles of accessible health care, self-determination, and private medical decision-making. Placing restrictions on publicly funded health insurance will impact our most vulnerable community members and limit health care options for essential care. This bill is not motivated by medicine or an interest in the well-being of Missourians. This bill will continue to erode reproductive freedoms while also jeopardizing the health and safety of families across the state. And for these reasons, the ACLU of Missouri and its membership urge you to vote no on SB 810.
Any questions for this witness? Thank you for testifying. I'm sorry, Ms. Feltz, when you testified, are you employed by Planned Parenthood currently?
I am, and I testified on my own behalf today. I'm not a registered lobbyist.
Okay, great. Thanks so much for that. Anybody else here in opposition?
Hi there, good morning. My name is Vanessa Welberry. I am the Vice President of Policy and Advocacy at Planned Parenthood of Advocates of Planned Parenthood of the St. Louis region and Southwest Missouri, testifying in opposition and saying that this is a political stunt and it is at the expense of Missourians' health and lives. Here in Missouri, we are also already living under a dangerous abortion ban. A really dire maternal mortality rates, particularly with for Black women, and surging STI rates, notably syphilis. And now this policy would deny Missourians who rely on publicly funded insurance from using their insurance at trusted healthcare providers like Planned Parenthood. And Missourians will not be fooled. This is not about abortion. This is about playing politics with people's access to critical preventive services like STI testing and treatment, cancer screening, birth control, annual exams. You heard from some folks who are patients today. I want to address the picking up the slack comment that the sponsor made. Planned Parenthood, both Planned Parenthood affiliates in Missouri, nearly 20% of their health center patients rely on Medicaid for their care coverage, and Planned Parenthood serves approximately 50% of all family planning patients who rely on Title X, the Right Time, Medicaid providers, in the Missouri Family Health Council's family planning network, as you heard today as well, including in the evenings and on weekends. So any suggestion that patients can just go somewhere else or go to another provider is simply wrong. There aren't enough sexual and reproductive health care providers to fill the gap. Excuse me. So this bill is discriminatory, it's irresponsible, and it would issue a devastating blow to our public health safety net here in Missouri.
Thank you, Ms. Wilbury. You are an employee of what entity?
Advocates of Planned Parenthood of the St. Louis region in Southwest Missouri.
Can you explain how that entity relates to the clinics that are in the state and owned by other affiliated organizations?
Yeah,
Or that org chart, it looks like.
we're a separate entity. We're the advocacy arm of the Planned Parenthood affiliate.
Be more specific. What's the name of the Planned Parenthood affiliate?
Planned Parenthood of the St. Louis region in Southwest Missouri.
Okay, and does that affiliate own any clinics that provide abortion services?
In Missouri, no.
Anywhere, in any state?
Planned Parenthood Reproductive Health Services in Illinois provides abortion care.
So the organization for which you work is a provider of abortion services?
The organization that I'm testifying on behalf of today is Advocates of Planned Parenthood.
Right? So the Advocates of Planned Parenthood is an entity that is owned by an entity that owns clinics that provide abortions, not in Missouri, but in Illinois. Is that that's correct, right?
I mean, they're separate entities. That one doesn't own the other, but
are you sure
we're
about
an
that?
advocacy. We're the advocacy arm. So
if you're the advocacy arm, it typically means corporate umbrella. You're owned by the same entity. Is that correct?
I'm not sure I'm understanding how this is relevant to what we're talking about
That's
today.
okay.
Which
You don't have to understand why it's relevant. I do, and I'm wondering if you could help walk me through who owns the entity for which you. The direct claim of the bill sponsor is that by supporting Planned Parenthood clinics, that those clinics are funding abortion services, maybe not in the state of Missouri. And the primary claim that you are making is that it is the policy of your entities locally, right, that you're not providing abortion services in Missouri, and so you should still be eligible for Medicaid services, reimbursements. And why it's relevant is if your entity is owned by an entity that provides abortions, it really does make the argument for the bill sponsor. Do you think that your policy arm would be willing to give up your Planned Parenthood affiliation in order to receive that $200,000 in state funding? Then the clinics could operate as Medicaid providers in the state under this new proposal. You just would have to give up the affiliation with Planned Parenthood, and the Missouri workers and clinics that are in the state could continue to do all the services that they're doing today.
Planned Parenthood is a trusted healthcare provider to many, many patients. So I think that that's a really important piece here.
It's more important than providing care. You could drop the affiliation and you'd be able to provide the care still.
It's not that simple, and that is not what Missourians want, and that is that is a very simplistic point in terms of
does the Planned Parenthood policy arm, are you all in any way an employer of clinic workers across the state? Does the entity that you work for employ clinic employees across the state of Missouri?
Planned Parenthood of the St. Louis region in Southwest Missouri does, yes.
Okay.
Employs clinicians, healthcare managers,
Are they
their health centers.
Are they
yes.
the owner of the clinic that was in question, that was referring and providing everything but the abortion to the undercover video, or was that a different provider on the other side of the state?
That is our sister affiliate, Planned Parenthood Great Plains, I believe, if that's what you're referring to. But we are
Are there any
confident.
other Planned Parenthood affiliates in the state other than the St. Louis one, which owns a clinics in Illinois that provide abortions, or the affiliate in the Kansas City region that owns clinics that provide abortions in Kansas City? Like, is there maybe the bottom part of the state, are they governed by a third affiliate that?
No.
It's just the two in the state?
Correct.
Okay, thanks so much. I appreciate your testimony. Anyone else have any questions for the witness? Sure.
So I think it would be clarifying, and maybe you don't have the answer, maybe no one here has the answer, but I think it would be clarifying if Planned Parenthood could give additional information about the organization and what that org chart looks like. I imagine there are limitations on how that funding is used, and that there are legal guardrails, barriers on commingling of funds. So I appreciate that that's complicated. I think that there is probably a helpful answer that the committee would appreciate knowing. But ultimately, what I would argue is, one, Planned Parenthood clinic shouldn't have to drop their Planned Parenthood affiliation just because the Missouri legislature doesn't like it. And two, I would argue that the funding that is going towards services at Planned Parenthood is all healthcare related, allowed under Missouri state law. That's what that funding is going towards. It's not going to go allow access to abortion in other states. The funding is used on Missourians for healthcare services rendered in Missouri.
Thank you. Thank you for that. And yes, I think we could follow up with information about compliance and all of those things. And when we say funding, I want to really be clear. This is about allowing people to use their insurance at Planned Parenthood, right? It's not some, blank check. It's a health center that complies with all state and federal laws and regulations.
Thank you.
Any further questions, Senator Washington?
Just a quick follow-up. Thank you again for everybody being here today. Like you said, this bill's about allowing someone to use their insurance. So your understanding of the bill, would it prevent me, a state employee, from using my insurance at Planned Parenthood, or only those who are recipients of Medicaid?
I'm not sure. I have to get back to you on that. Yes, I know Medicaid is the major target and has been over year after year in the budgetary process.
So if I'm poor, I can't choose where I want to go, but if I can pay my premiums, I can make a decision for my health care.
It does create a tiered system for access to health care, yes.
Thank you.
Thank you for your testimony. Any further witnesses in opposition? I think I had remembered a couple hands up. Yeah, go ahead.
Hi, can you hear me? Okay, cool. Sorry, I'm not used to the Senate rooms. My name is May Hall. I'm 23 years old. I live in Columbia currently, but I'm from St. Louis. So there's a couple of things. Yes, I put it right here. There's a couple of things that I think need to be addressed about this bill. First of all, there is exactly one Planned Parenthood in Columbia. It is vital to the care of people I know in that city, not just for women's health care, but I have a friend who gets their testosterone through there. I have friends who get basic checkups from there. I have friends who are sexual assault survivors who, again, like some of these witnesses have mentioned, are only comfortable going to Planned Parenthood. In addition to this, we heard the bill sponsor talk about minors making these choices without the consent of the parents. I just want to say there is a section in the medical age of consent laws that do say that in cases of pregnancy or marriage, those under 18 can make those medical decisions without parental consent. But additionally, referring people out of state is just a matter of safety in some cases. I remember in early high school, a friend of mine had to go to a Planned Parenthood to get an abortion after being raped. She was 15 years old. If her family had found out that she was pregnant, that I can't imagine the consequences. Was by a family friend who, after she told them, they told her, we don't believe you, and they still continue to associate with him. So these things need to be taken into consideration because survivors don't always have that clean break. Sometimes they're still around these abusers, and sometimes the family is partial to those abusers. So this ability to travel out of state and continue that affiliation is important on a safety level. And then additionally, we've heard a bunch of people speak on the necessity of just general care, and I think that affiliation tells these people that this is a safe place to go. You've mentioned multiple times, why don't you drop the affiliation? That affiliation tells them which thing is a medical health care provider and which one is one of these pregnancy resource centers that will steer them in the direction of, oh no, do have that baby. Disregard the necessary health, like in cases where it may not be an entirely viable pregnancy and termination might be the best option. Sometimes you do need to go out of state to get that care, and someone needs to be honest with you when it is time to do that.
Thank you for your testimony today. Is there anyone who has any further questions for this witness? Seeing none, thank you for
Thank you so
traveling
much.
here. Any further testimony in opposition? Seeing none, this concludes the hearing on Senate Bill 810.